Tonight, my first guest is Dr. Jim Bean, who is a neurosurgeon with Baptist Health. Welcome. Thanks for coming in.
Thanks for inviting me.
Now, a lot of what I see in my office in terms of musculoskeletal injuries is back pain. And sometimes it's simple as a muscle strain and gets better. Some people don't even come to the doctor, it gets better on their own. But sometimes it's more than a muscle. What are some symptoms that may indicate, I better look a little further?
Anything that is a pain that's not common, that you've been living with for a while, fairly acute, almost immobilizing, that doesn't have an explanation, can be very serious. And that's the first thing I want to mention. We want to make sure there's nothing really serious behind that pain and that it's going to get better like 95, 98% of the time it does. We have to worry about things like cancers that could have caused a bone collapse. We have to worry about infections that might have gotten into the body and into the spine, cause severe back pain. We have to worry about major ruptures that can damage nerves in the back. Those are the things we worry about and want to make sure aren't happening. And if they're not, almost everybody's going to get over or manage this problem themselves or with a little help from some therapy or some medications of some sort.
Are there symptoms that the patient might notice that says, maybe this is something I ought to look at? Numbness, tingling in the leg, weakness, anything like that that's more important than another?
Yes, if you have developed numbness in the leg or tingling in the leg, or especially weakness where the foot drags perhaps or the leg gives out, it could mean a pinched nerve. And a pinched nerve in the lower back most commonly is going to happen because one of two things. Either there's been a buildup of arthritis and bone spurring that pinches it, or a rupture of the part of the spine that I'm going to show you right here is called a disc. It's right between the bones of the vertebrae, and if it ruptures toward the back against a nerve in the back of the spine, that's going to cause pain to run right down your leg, and the pain that comes from that can be bad.
Well, now, we've got the model there. It's easy to see, but how do you make the diagnosis in a person? Does everybody need an MRI?
Almost every time you can tell that it's a pinched nerve simply by questioning and by doing a little examination. One of the things that's almost always present if a nerve is pinched is it's difficult to raise the leg with the knee straight when you're reclining on a table. That stretches the nerve that's already pinched, and almost every time that's going to tell you that's a pinched nerve. If you see that there's loss of sensation in a particular toe or one side of the foot, that's a nerve, and in fact, it can tell you which nerve it is by where the location is. It's like a wiring diagram in the back.
Well, let's say that the worst case scenario, you've got a herniated disc, and you've tried all the simple things, but now they come to you because they need surgery. You're a specialist and do the what they call microsurgery?
Yes, we do different kinds of microsurgery, and it should take a lot of the fear out of surgery, as well as the time to recover. Let me show you one of the things I mean. In order to do the surgery necessary on a disc that's been herniated, which is the same as rupture in many cases, in order to get to it, you have to come through the back. We can use a little device, which this says 16 millimeters. It's almost the size of your little finger. That would sit on the spine, and through that, you could go into the spine, remove the thing that's pinching the nerve, have it done as an outpatient, and go home the same day with the pain gone. It works extremely well in the right situation.
You say the right situation. Can most people that require surgery be operated on like this, or do some people require a bigger procedure?
Some require a bigger procedure, but I find that most with your typical pinched nerves in the back, if it gets to the point where you need surgery, this will almost always take care of it. Now, there are others. There are certainly others. And one of the other conditions happens more slowly, more commonly in the elderly, and that's where the bone spurs build up and pinch the nerves all together right in the middle. It's just like squeezing a ring down over them. Now that's different, and in order to get at that, you can use the same kind of approach. You just have to move it over the bone and remove the layer of bone on the back. That's called a laminectomy. That opens the roof off the back of the spine and alleviates the pain. And that's the same way you could go home the same day for a single level that way.
That's called spinal stenosis. And are the symptoms a little different?
They are quite a bit different. Almost typical. It's called a strange name, neurogenic claudication. But forgetting that, this is something that hurts in the back when you stand up. And if you bend forward or sit down, it gets better. Usually it'll run down into your hips and into your legs. And as it gets worse, the distance you can walk is shorter and shorter, to the point that some people have to walk bent over or holding on to a cart or a basket or a walker. Once you relieve it, they can straighten back up. It's almost miraculous in some cases.
That's the hard part. But most people can avoid surgery. Most people can get by with medicines, physical therapy, and time.
Absolutely. It's important to take care of yourself. Weight loss is so important. Exercise, toning your muscles, your abdominal muscles and your back muscles, doing stretching exercises. Getting regular exercises. Everybody can walk. And walking is the easiest thing to do. And once it gets past the point that that actually begins to alleviate it and help, then I look at it.
Well, we hope that you can fix it without surgery, but if you need it, Dr. Bean's one that can do it. We'll be right back after this message.